Hello, everyone. In this video lecture, we continue covering the reproductive system. And today we will talk about female reproductive system. Also, this is only anatomy of the reproductive system, and physiology will be recorded later, right? So that's reproductive system, part 2, the female reproductive system. So let's go ahead and begin. So I will pick up my pen. So organs of female reproductive system include ovaries or female gonads. They produce female gametes or ova and secrete female sex hormones such as estrogen and progesterone. Organs also include internal genitalia that are located in the pelvic cavity and include, you can see on the diagram right here, ovaries, right? So that's an ovary. Then system of ducts, including uterine tube, what was called fallopian tube before, uterus, and vagina. So you can see those organs are inside pelvic cavity. And then we have external genitalia that also part of the female reproductive system. So again, system, any body system includes organs. Those organs work together to perform common functions. Female reproductive organs include ovaries, internal genitalia, and external genitalia. So let's start with external genitalia first, and vulva. That's another name for external reproductive structures. Vulva includes mons pubis right here, that is a fat pad, labia majora, that is a structure here. Right, so here's our labia majora. Those are folds of a hair-covered skin posterior to mons pubis, and labia minora or minora that extends medial to the labia majora. So over here you can see another nice diagram when skin and subcutaneous fat and muscles were removed. So you can see this pelvic bone, and this is ischium. So you can see the location of the vulva, right, including the vagina here and clitoris. So let's continue. So here we have a clitoris for sexual sensation. Hymen is a thin membrane covering the opening of vagina, and greater vestibular glands that you can see on a picture over here. They release mucus into vestibule for lubrication, and vestibule you see on the diagram above. Now we will move towards internal reproductive organ, and we're going to start with vagina. It's a muscular canal about 10 centimeters long, entrance to reproductive tract, and exit during menses and childbirth. So here's the vagina shown right here. that is muscular tube. It has those folds that we call rugae. It's a mucous membrane with a rugae, the most internal or deep layer of vagina. So layers include fibrous adventitia. So the fibrous adventitia will be the most superficial layer. Then smooth muscle, shown actually here, and mucous membrane with rugae. And if you remember, mucous membrane is made of epithelial cells, epithelial tissue, and connective tissue. In vagina particularly, you would have stratified squamous epithelium. So you need several layers of cells for protection of this organ. Inside vagina, you will find what we call normal microbial flora, and the most common bacteria is lactobacilli. Now we're moving superficially. Oh, I'm sorry. We're moving not superficially, but superiorly. So we started with vulva, then we're moving to vagina, of course, in reference to anatomical position. We move from inferior to superior part. So we're moving from vagina now to uterus. So here's the uterus over there, and it's muscular organ that supports growing embryo, 5 centimeters wide, 7 centimeters long, and it's made of 3 major parts. This top part is called fundus. Then we have body of uterus and cervix. Cervix in anatomy means neck. And you can see cervix protrudes inside vagina. And we have external os and internal os and cervical canal in between them within the cervix. These folds here and here are called fornix. So we have 2 lateral fornices, and we have anterior and posterior fornix as well. Position of uterus. So let me. Anteroverted is a normal position. So if you look over here, this is normal position of the uterus. This is anterior part over here, and this is posterior. So it's antero means towards, anterior. Verted means it is like what? Located towards anterior part of the body, anteroverted, inclined forward. Over here, you can see retroflexed, so completely flexed to the opposite side, or on this picture, we have retroverted. So this position considered to be retroverted. This position is retroverted. If it's completely flipped to the back, then we call it retroflexed. But retroflexed is also retroverted. So it's inclined backward. Why this would be a concern? Because this area over here is your rectum. So it's a part of digestive tract. And when the uterus inclined backwards, it will put, pressure to the rectum. So you would expect problems with defecation in a female with a retroverted position of uterus. There is also prolapsed uterus. And so you can see on this diagram here, the uterus is very low. So this, by the way, this is vagina right here. Oh, this is a vagina. Vagina is posterior to urethra. This is urethra. This is urethra. And this is urinary bladder. So you can see here, you see urethra, but you do not see vagina. So the uterus prolapse through vagina. And sometimes it can be complete prolapse, and uterus can even fall out of the pelvic cavity. Now, if you look at structure of uterine wall, it's made of 3 layers. Perimetrium is not shown on this diagram, but it's the most superficial layer. Then we have myometrium. Myo means muscle, so this part over here is myometrium, so it's a smooth muscle fibers. And endometrium, let's start from this part all the way up. So this is the deepest layer of uterine wall. And endometrium is divided into stratum basalis and stratum functionalis. Here we have a lumen of the uterus. And this stratum functionalis is made of epithelial tissue and underlying connective tissue. Over here, that is called lamina propria, rich in glands. So you can see uterine glands shown right here. So uterine glands produce the products within the lumen that is critical for development of the fetus. Blood supply to a uterus includes so it will include the ovarian artery. So we have right and left ovarian arteries that branch from abdominal aorta, and you can see they move toward the ovary. That's the ovary. And we have 2 more blood vessels, larger blood vessels that supply uterus, and they branch from internal iliac artery. So it's a uterine artery right there, and vaginal artery. Well, vaginal artery kind of goes to the vagina. So it's a blood supply, I would say blood supply, not just the uterus, but internal female reproductive organs. So ovarian arteries supply ovaries, uterine arteries supply uterus, vaginal arteries supplies vagina, but you can see there is lots of anastomosis over here, right, between the uterine and ovarian arteries. Now let's see what happened with uterine artery. So here's the uterine artery that runs towards uterus, and then it gives branches, and those branches are called arcuate arteries. So they look like arches, arcuate. Then we have arteries that radiate from arcuate. So they are radial arteries. And then radial arteries branch into straight arteries and spiral arteries. And those spiral arteries goes all the way towards the stratum functionalis. So that's the upper part of the endometrium. So let's look over here, I'll show you. So stratum functionalis right there. So those spiral arteries give branches all the way to the stratum functionalis. Also in this picture, you can see veins. We call it venous sinusoids. And sinusoids in anatomy represent kind of bigger in diameter and flat veins. Those sinusoids bring blood to endometrial veins, and then we have our uterine vein here. So we do have this arcuate right there, and then uterine vein. Also, you can see a gland, uterine gland over here. So right there, and it's an exocrine gland. So it secretes inside the tube, and through this tube, product goes inside the lumen of uterus. So uterine arteries branch into arcuate arteries, so that's what it says here, in myometrium, and branch into radial arteries in endometrium, and branch into straight and spiral arteries. And during menstruation, we have spasm of the uterine walls that cause shedding of this functionalis layer. And as you can see, we have a lot of blood vessels, arteries, and venules or sinusoids within stratum functionalis. So that's why when this part is shed off, we have bleeding or menstruation. Some of us do. Menstrual cycle is changes to the uterine lining, shed, rebuild, and prepare for implantation, and then start this circle all over, right? Shed, rebuild, prepare for implantation of the embryo. If this didn't happen, we shed the functionalis again, rebuild, again prepare, and it takes about 28 days. In the menses phase, when we have this menstruation, lining is shed, but not all the lining, only functionalis. Basalis is not shed, it stays attached. So here's our basalis, right? And here on the top, we have functionalis. So functionalis is shed, and menses phase lasts about 5 days, so between 2 and 7 days, and that's what we call women menstruates. So this is actually a pretty nice histology picture. You can see perimetrium here, myometrium, muscle of the uterus, and endometrium that is made of stratum basalis and functionalis. Now, ovaries are female gonads, about 2-3 centimeters in length, located in pelvic cavity. So this histology, oops, sorry, clear. This histology, I wonder why I cannot clear it. Clear all drawings. Excuse me. That's not what I wanted. Okay, so let's start again. So here's histology slide of the ovary. It has tunica albuginea, that's connective tissue, white connective tissue, and most superficial part, we have germinal epithelium over here. So you have germinal epithelium, tunica albuginea. Then ovaries are divided into poorly defined regions, cortex and medulla. And within cortex, you see lots of these circular structures, right? And over here, the smaller circular structures, those are follicles, ovarian follicles. So this is a diagram of ovarian follicle. And what is inside is immature egg or oocyte. So here's a yellow part with a little red dot, that's represent immature egg or oocyte. And then all these dots or these little ovals represent cells. So you can see that oocyte is surrounded by granulosa cells. And then we have layers of follicle are made of theca. So we have theca interna, shown here in green color, and theca externa, shown in gray color. All of these cells have their function, important function, right? I'm just going to mention some of them. This theca interna, they're going to secrete androgens. It's interesting, right? Yes, that's a female reproductive system, but theca interna secrete male sex hormone, androgens. And then granulosa cells, they're gonna change androgens into estrogen, that is female sex hormones. So pretty much theca interna and granulosa cells involved in synthesis and secretion of female sex hormone estrogen. So this picture shows you ovary again, but now it's not a histology slide, it's just a diagram. And you can see follicles, and follicles look, like small, and then they get bigger, right? So here's a huge follicle. And then we have rupture of a follicle called ovulation. So this diagram tells us that follicles go through several stages of development. We have primordial follicles that have single layer of follicle cells plus oocyte. So you have oocyte and you have single layer of cells. We call them follicular cells. Then follicle start changing, they start growing, cells divide, and oocyte inside is changing too. But that's a topic of physiology. In anatomy, we can see that we start with primordial follicles, we are born with them, and then the follicle get bigger, and it's made of several layers of cells. Now we call them granulosa cells. In this stage 3, you can see cavity formation. So we have spaces filled with fluid inside. Then over time, and time goes this way, those smaller cavities, they fuse together, forming a large cavity. This is called antrum. So when the follicle has this large cavity, we call it vesicular or antral follicle, and Graafian follicle is a mature follicle. So this is the follicle that is ready to eject the egg out of the follicle. This process of egg ejection is called ovulation. Now you can see that everything is regulated by hormones. So this is follicle stimulating hormone, luteinizing hormone. They produced by your pituitary gland that is located in your cranial cavity. So under the regulation of these hormones, we have ovulation of the egg. Now, what's going to happen with this follicle now, all these follicular cells? These follicles will change into this yellow structure that we call corpus luteum. A corpus is body, luteum is yellow. So it's a yellow body, corpus luteum, so right here. And then corpus luteum degenerates at the end. Corpus luteum secretes progesterone. That is important hormone in a female cycle, reproductive cycle. What progesterone does, it's actually keeps this stratum functionalis attached. So it's prevent shedding of stratum functionalis. Because look, if you have ovulation, you form an egg, right? So you hope that this egg, well, evolution hope, our species hope that this egg will be fertilized by the sperm. Like while we're waiting for fertilization and hopefully implantation and further development of the fetus, we want to keep this stratum functionalis attached. So in other words, we don't want female to menstruate when egg is ready to be fertilized. That's why we need this progesterone that's gonna keep stratum functionalis in place. We also have ligaments that keep ovaries and uterus in their position. We have way more ligaments than shown on this diagram, but those are three major ones. So we have ovarian ligament over here, and ovarian ligaments keeps ovary connected to uterus. Keep in mind that ligament is not a tube, so it's just like a roll over here. So the egg cannot move through ligament to uterus. There is no point. So the egg actually ovulated to the pelvic cavity, and then it will be picked up by the uterine tubes or fallopian tubes. Right, so this is ovarian ligament. We have this one that is suspensory ligament, and this huge one shown here in a yellow color, right? This is broad ligament, and broad ligament is modified peritoneum. So that's a peritoneum that forms broad ligament, and it supports the uterine tubes, uterus, uterine tubes, and ovaries. Uterine tubes, talking about uterine tubes. They conduct oocyte from ovary to uterus and not directly connected to ovary. So here's our ovarian ligament, here's the ovary, and you can see follicles, kind of, right? And this is our corpus luteum. If we have corpus luteum, so hopefully the oocyte was ovulated, and uterine tubes must take this oocyte in, right? Now uterine tube are made of three parts: isthmus. Isthmus is in anatomy means narrow part. Ampulla, right? So the ampulla. Infundibulum is this part, and what attached to infundibulum are those fimbria, or finger-like projections, and they move. So they form this, weak current of the fluid from a pelvic cavity inside uterine tubes. So the ovum can move inside because of the movement of fimbria. So you create current, right? And you take this fluid, whatever you have, and ovum with the fluid. And fertilization happens actually over here inside ampulla of fallopian tubes, because sperm is coming this way, right? Sperm coming this way, and ovum is, ovum is coming this way, right? If you heard about ectopic pregnancy, ectopic pregnancy means pregnancy not within uterus. So sometimes, let's say, if a female has lots of scar tissue in fallopian tubes because of maybe chronic inflammation, well, it might just kind of like narrow the tubes. And if fertilization happens here, the the egg actually can implant itself, fertilized egg, implant itself into the walls of tubes, and then fetus start developing inside the tube. And you can imagine you don't have enough room over here for fetal development. That's what ectopic pregnancy is. Sometimes ectopic pregnancy can happen even within pelvic cavity, right? When the sperm kind of like, oops, or even fertilization can happen inside the fallopian tubes. That most likely, because it's very, I don't think you can fertilize anything in a pelvic cavity because it's a huge space. So if fertilization happens here, but then egg moves in the opposite direction, instead of moving inside uterus, it moves outside of fallopian tube into pelvic cavity, and it can implant itself somewhere within this cavity. So it's another type of ectopic pregnancy. Now, oocyte movement are caused by contraction of smooth muscles within uterine tubes, because oocyte cannot move on its own. We need some type of current, some type of contraction to move oocytes towards uterus. And breast, that is also an organ of female reproductive system. Breast is made of mammary glands. Oops, I'm sorry. Mammary glands. Mammary glands are modified sweat glands. So over here you can see how glands look like, exocrine glands. So they have a duct, right, and secrete their product within ducts. So we have milk secreting cells, glandular epithelium, and we have myoepithelial cells, those cells that can contract. And when you contract, you eject milk toward the nipple. So this colored part is called areolar. We do have areolar glands. Here on the lateral sides, you can see our mammary glands. So those are mammary glands, and they have those tubes. We call them lactiferous ducts, right? So we have lactiferous ducts, and then those ducts bring milk to the lactiferous sinuses, and then to the nipple. And when baby is hungry, baby can suck the milk out of the nipple. Also inside, you can see this suspensory ligament that separates breast into lobules. And lobules contains alveoli, and alveoli are those units, right? Those units of mammary glands. Right, so again, what do we have here? We have areola, we have nipple. Within areola, we have areola glands. Now, the glands in your breast are called mammary glands that are modified sweat glands. Suspensory ligament divides breast into lobules. Within each lobule, you have alveoli that, you know, this part over here, that are secretory units of mammary glands. Now, those alveoli secrete milk inside lactiferous ducts and then lactiferous sinuses and towards the nipple, right? And the rest of tissue is areola tissue, oh, I'm sorry, areola, adipose tissue, so it's a fat. So the size of a breast, so you can see that's a fat tissue. Size of a breast depends on the amount of fat tissue more than on amount of those alveoli or you know, mammary glands. Right? So mammary glands, even a female with a small breast might have you know, large amount of this alveoli and secrete great amount of milk. How large the breast is mostly depends on the fat tissue. Okay, so, and next, breast cancer. So 10% due to hereditary defects, including mutation to genes BRCA1, BRCA2. People with those mutations have 50 to 80% chance to develop breast cancer. Right, so I mean, if you take if you look at the statistics, so 10% of people with breast cancer will have this gene or defect in those genes. We all have those genes, but we don't have defect. So if you have defect in those genes, if somebody has defect in those genes, their chances of getting cancer increases, right? And also mutation of these genes give you a greater risk of ovarian cancer. So breast cancer stages can be divided into stage 0 to 4. And a 5-year survival rate, you can see over here. So this stage 0 and 1, well, stage 0, we have very small region of the gland that has some kind of tumor. And it's not cancer. It might be just, benign small tumor. It can develop this, if this can develop into cancer, we still consider it to be a stage 0. It's, of course, it's just inside the breast. There is no any spread. Stage 1, when the tumor is less than 2 centimeters, it's still not considered to be a cancer, and it's confined to the breast area, not outside, and it's 100% 5-year survival rate. Stage 2, when we have, I'm sorry, this is the lymph nodes, right? So stage 0, nothing in the lymph nodes. Stage 1, nothing in the lymph nodes. Stage 2, when the tumor is bigger and it affects local lymph nodes, and you can see it's still in the breast area, not outside, but lymph nodes are affected, and 87% 5-year survival rate. We move further, right? We have like 5 centimeter and more, then it's stage 3. Plus, we have affected lymph nodes, and cancer might spread to the muscles and skin near the breast. And stage 4, when cancer spreads into many organs of the body, outside of the breast area, it can be in a internal viscera. The cancer can progress to bone marrow, right? And this gives pretty, low 5-year survival rate. So what this diagram tells us, that it's critical to diagnose breast cancer at early stages, when we have small tumor, when lymph nodes are not affected, or at least, maybe some locally lymph nodes affected only, as it's shown over here, right? The tumor, and here we have axillary, usually axillary lymph nodes are the ones that we can palpate. And if they are enlarged, that might be some type of concern. Right, so that's critical to diagnose breast cancer at early stages. So that's why it's important to do the examination of your breast, right? So early detection via self-examination, and of course, mammography. Mammography is X-ray examination. For example, American Cancer Society recommends screening every year for women 40 and over. But of course, before the mammography, you can always do, well, mammography can show you something that you cannot palpate yet. So mammography is important, but self-examination also can save our lives, right? So let's look at the warming signs, the most common signs to look at. First is pain in one spot that does not go away. Swelling, warming, redness, darkness of the breast, changing in the size or shape of the breast, dimpling or puckering of the skin, rash on the nipple, or discharge from a nipple, pulling in of the nipple, and enlarged lymph nodes, hard node or thickening inside the breast or underlying area, including axillary area, right? So those are all warming signs. And treatment of breast cancer include radiation, chemotherapy, surgery, often followed by radiation or chemotherapy, or we can patient can have radiation and then surgery. So the treatment will depend upon characteristic of a lesion. Some breast cancers are estrogen responsive, and then patient would get drugs to low estrogen level in their blood. Surgery include radical mastectomy, that removal of entire breast, all underlying muscles, fascia, associated lymph nodes, or simple mastectomy, when we remove only breast tissue, sometimes some axillary lymph nodes, but we can remove, for example, only one breast. In a radical mastectomy, both breasts can be removed, plus some muscle, some fascia. Here, we just remove one breast tissue, some nodes, or it can be lumpectomy, when we only remove the cancerous lump. And some females will go through breast reconstruction. On this diagram, you can see a mammogram procedure, right? And this is a film of normal breast and film of breast with tumor. So this kind of part over here shows us malignancy. Okay, so I think this was the last slide in this PowerPoint before we get to physiology part. All right, so thank you so much for watching, and I hope it was helpful.